On this edition for Sunday, April 12th, worshippers observe Easter Sunday from home as stay-at-home orders remain in place globally. In our signature segment, coronavirus spreads in Central Africa, just as they nearly hit a milestone in the defeat of another epidemic. And Dis Dancing, global disco bringing people together. Next on PBS NewsHour Weekend.
PBS NewsHour Weekend is made possible by Bernard and Irene Schwartz, Sue and Edgar Wackenheim III, the Cheryl and Philip Milstein family, Rosalind P. Walter, Barbara Hope Zuckerberg, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments.
Consumer Cellular offers no-contract wireless plans that are designed to help you do more of the things you enjoy. Whether you're a talker, texter, browser, photographer, or a bit of everything, our U.S.-based customer service team is here to find a plan that fits you. To learn more, go to consumercellular.tv.
Additional support has been provided by the Corporation for Public Broadcasting, a private corporation funded by the American people, and by contributions to your PBS station from viewers like you. Thank you.
We are continuing to bring you our reporting from multiple locations on this Easter Sunday. Staying safe means social distancing and working remotely whenever possible. Here in New York City, there are some signs the virus may be slowing, but it continues to spread across the country and around the globe. Let's get started with today's top news. For billions of Christians, this was a different Easter. Many across the country and around the world worshiped from their homes as churches and cathedrals offered broadcast and online services.
We miss you, though. We'd rather you be here physically.
From New York St. Patrick's Cathedral to churches in every state, the coronavirus pandemic created new rituals for millions. President Trump remained at the White House and released a recorded Easter message.
This Easter will be much different than others because in many cases we'll be separated physically only from our churches. We won't be sitting there next to each other, which we'd like to be, and soon we'll be again.
Despite stay-at-home orders and online services, a few pastors went ahead with services in person. There are now more than 530,000 confirmed cases of COVID-19 in the U.S. Of the more than 20,000 deaths, close to 30% have been in New York City. But infections are widespread and still growing. The Centers for Disease Control and Prevention reports more than a dozen states now have at least 5,000 cases each. With the different rates of infection and the rising unemployment rate, Dr. Anthony Fauci said this morning there is a possibility some areas of the country could see businesses begin to reopen next month in what he called a rolling reentry.
It is not going to be a light switch that we say, okay, it is now June, July, or whatever, click, the light switch goes back on. It's going to be depending where you are in the country, the nature of the outbreak that you've already experienced, and the threat of an outbreak that you may not have experienced. I think it's going to have to be something that is not one size fits all.
Today, British Prime Minister Boris Johnson was released from the hospital after almost a week. Johnson was taken to St. Thomas Hospital in London last Sunday after suffering persistent symptoms from COVID-19. He spent several days in an intensive care unit. In a video statement today, Johnson thanked the National Health Service, or NHS, for saving his life.
In the last 7 days, I have, of course, seen the pressure that the NHS is under. I've seen the personal courage, not just of the doctors and nurses, but of everyone, the cleaners, the cooks, the healthcare workers of every description, physios, radiographers, pharmacists, who've kept coming to work, kept putting themselves in harm's way, kept risking this deadly virus.
Johnson is not immediately returning to work and is continuing his recovery at the Prime Minister's country residence. Johnson's release comes as the UK marks a grim milestone. Officials announced today that virus-related hospital deaths surpassed 10,000. For the second time in a week, Queen Elizabeth released a message to the British people. In an audio statement, the 93-year-old monarch said that, quote, "Coronavirus will not overcome us."
This year, Easter will be different for many of us. But by keeping apart, we keep others safe. But Easter isn't cancelled. Indeed, we need Easter as much as ever.
Christians all over the world followed social distancing guidelines on this Easter Sunday as worshipers kept their distance. In a mostly empty St. Peter's Basilica, Pope Francis called for solidarity in the face of the coronavirus pandemic, saying that this is not the time for self-centeredness as the world faces the challenge together. In Spain, a national lockdown forced Spanish Christians to stay at home, and this Mass, which normally would have had nearly 2,000 people in attendance, was live-streamed instead. In Germany, priests held Mass at a drive-in movie theater. Parishioners in their own cars could worship while still keeping their distance. And in Kenya, clergymen wearing masks held Mass in an empty church. To hear about how your smartphone could help trace the spread of COVID-19, visit pbs.org/newshour to hear our interview with MIT's Ramesh Raskar. Compared to other parts of the world, coronavirus was slow to reach the continent of Africa, but the infection is spreading rapidly. The number of confirmed COVID-19 cases on the continent has grown to more than 13,000, with more than 700 deaths so far. This new pandemic comes at a time when areas in Central Africa had just about claimed victory in the battle against Ebola. NewsHour Weekend special correspondent Benedict Moran and video journalist Jorgen Samso bring us the story.
On March 3rd, in this Ebola clinic in the city of Beni in the Democratic Republic of the Congo, medical workers celebrated a milestone. Samida Masika was their last Ebola patient, and she was cured. Before Masika left the clinic for home, she thanked the doctors and nurses who saved her.
Frankly, I don't know what to tell you. I only ask God to bless your work and your efforts.
Ebola can cause headaches, fever, and severe hemorrhaging. It's transmitted by contact with bodily fluids. Without treatment, it's nearly always fatal. The outbreak has infected more than 3,500 people and taken more than 2,000 lives. It was the largest in the Congo's history and the second largest in the world after the 2014 outbreak in West Africa. But now Ebola treatment centers are quiet. Almost. Until yesterday, no new cases had been reported since February 17th, and the 21-day incubation period was about to expire for the second time. The World Health Organization seemed poised to declare that the epidemic was over. Then a single case was reported, and so the fight continues. But getting even this far has been an extraordinary achievement. Ibrahima Sochefal is the WHO's Assistant Director General for Emergencies Response.
It took a lot of work really to come to this point. We have recorded more than 3,500 cases and over 2,000 deaths in this very complex environment.
This outbreak began in August 2018 in the remote north of the country. Ebola then reached major cities, including here in Beni, and risked spreading across East Africa and beyond. Thousands of international and Congolese health workers took part in the response. They worked in treatment centers, and they helped bury the dead. Trying to end this outbreak has not been easy. For the past 20 years, this part of Africa has been convulsed by war that sometimes prevented health workers from reaching patients.
You have more than hundreds armed groups operating in that area. So to reach to the most remote areas was extremely difficult for our teams.
Authorities set up checkpoints on major roads to take the temperature of travelers. Anyone with a fever was told to isolate themselves at home and tracked in case their condition deteriorated. Health workers had access to a new vaccine, and it was used to immunize more than 300,000 Congolese. But the spread of misinformation caused major setbacks. Some churches spread falsehoods about Ebola, saying, for example, that it could be cured with holy water. Meanwhile, other rumors, including one that Ebola didn't exist, and another that it was a plot to control the population, went viral on social media platforms. The result was deep mistrust of the Ebola response. Many patients refused to share information with medical workers attempting to track and monitor their contacts. Trish Newport worked in Ebola treatment centers for the international medical group Doctors Without Borders. She understands why the population was concerned.
If I didn't trust someone and I had Ebola, And the people I didn't trust came to me and they said, can you give me a list of everyone close to you in your life so I can go to their home and follow them twice a day for 21 days? I also wouldn't give the list.
This mistrust culminated in startling violence against Ebola responders. Rebel groups and angry civilians attacked health centers, killing 11 health workers and injuring dozens. The violence prompted Ebola responders to suspend operations. Some health workers even went into hiding. Newport says communities only began to cooperate with Ebola responders once they were allowed to participate in their own care more directly. For example, by building their own isolation and treatment units.
So when they had a center that they trusted and they felt connected to, it made such a difference. And it made such a difference in the transmission in the community, because as soon as someone got slightly sick, they just came.
Meanwhile, medical workers used the airwaves to tackle false or misleading rumors and brought lessons on Ebola and prevention directly to schools and markets. Katsan Maliro worked for the WHO on the communication efforts.
As the number of Ebola cases went down, the community started to have confidence in us. We told them, okay, you followed our preventative measures, and now look, the disease is leaving your village. That was a huge joy.
Joy, but not quite yet victory, even as the DR Congo is pivoting to stopping the spread of coronavirus by using many of the same measures it has used in the fight to defeat Ebola.
COVID-19 is a disease of contact, just that. Without contact, there is no contamination. Just like Ebola. The fight against Ebola helped the community understand that we could also fight against other diseases just by washing our hands. That's so satisfying for us.
The World Health Organization notes that many more Congolese are now trained on the treatment of infectious diseases thanks to their work during the Ebola crisis. One of them is Nurse Kavira Kavota.
A lot of foreigners came here with their own experience and they trained us. It helped us. In the event of a new outbreak, we'll be able to take charge of the response ourselves.
Frontline health workers like Kavota are going from one outbreak to another, but they appear to be on the verge of one victory, at least for now.
What we learned from the Ebola outbreak between 2014 and 2016 helped lay the groundwork for the more recent response to the less deadly epidemic in the Democratic Republic of Congo. But as we've just heard, pandemics are hard to contain for a number of reasons. Lauren Baer was senior advisor to Secretary of State Hillary Clinton during the Obama administration and says there are still steps that can be taken to help control the coronavirus pandemic facing the world today. So Lauren, what did we learn as a government, as a country, from fighting Ebola?
Early action is critical to getting ahead of an infectious disease and forestalling a potential pandemic. And what we realized right from the outset was that this had the potential to be not only a public health crisis, but also an economic crisis, also a grave threat to America's national security. And because of that, because it was such a complex and multifaceted problem, we needed a coordinated whole of government response right from the beginning. That's why you saw the Obama administration create an Ebola czar. And that's why you saw it leave in the wake of Ebola, an entire office within the National Security Council dedicated to dealing with the risk of pandemics and response to them if they arose.
What's the difference on whether that office exists at the NSC or it doesn't?
The difference is, do you have the players and the experts on hand at the outset who are going to help you tackle a problem before it becomes a real crisis? And one thing I want to convey to the American public is that this didn't have to be this way. We didn't need to be dealing with death and just the fear on the scale that we have in the United States here. But what you had with Trump and his administration was almost a perfect storm, right? You have a leader who dislikes science, who distrusts experts. So he gets rid of that pandemic response office. He throws away the playbook. He ignores the warnings that were given to him in his daily intelligence briefings. You've got someone who doesn't like international cooperation. So he missed the opportunity at the outset for the US to exercise global leadership and coordinate a global response to coronavirus. He failed to take the early actions like ramping up testing, like encouraging social distancing way back in January that would have enabled us to get ahead of the virus.
What are steps that the administration can still take that it's not too late for?
It's never too late to cede control to the experts who really understand the disease, how it's spreading, and the controls that need to be put in place to ensure that we suffer the least in this country. And interestingly, this week, you've seen cries for that from within the Republican Party itself, asking Trump to step aside, put the medical experts front and center. The second thing that the government can do, we've been hearing a lot on the news about things like the Defense Production Act, which would enable the US government to ramp up production of things like ventilators and personal protective equipment for our medical personnel. This administration has invoked that, but they can still do more to ensure that our frontline healthcare workers are getting what they need. And the other thing that the government can do is really coordinate action amongst states. The federal government is uniquely equipped to set nationwide policies and standards that all states should be adhering to. And I was reading last night, for example, there are 10 states that still don't have statewide lockdowns. And that's a very frightening thing when we've seen the speed at which a cluster can arise when people move across state lines.
Internationally, considering your position from the State Department, what can the United States do now to take, perhaps as delayed as it may be, a leadership role, or in trying to coordinate what countries are doing?
The Trump administration needs to recognize that this pandemic is as much a test of US global leadership as any war. They can take some of the same steps that they could domestically, which is to say we need to cede control to the experts on the international stage. We need to keep politics out of this. And we need to allow our US experts to coordinate with public health leaders globally so that we can bring the full weight of the US government to bear.
One of the things, Lauren, that we saw was, for example, Asian countries, their responses, it seems that they had learned from SARS. What's the case in African countries? Are they likely to be more prepared or not, given that they have faced challenges like Ebola before?
What was critical to tamping down on Ebola was the fact that we had a coordinated global response. I would say they are less equipped now because we haven't seen that same global presence as we did in the Ebola crisis.
Lauren Bear, thanks so much for joining us.
Thank you for having me.
Quarantine means the end of so many normal social rituals. They're almost too numerous to count. But as NewsHour Weekend's Yvette Feliciano reports, some people still just want to get together and dance, and they aren't going to let being miles apart get in the way.
Each Tuesday and Friday night for the last month, dozens of people from across the U.S. and around the world have gotten together for a dance party. As you can see, it's quarantine-friendly. It's called the Social Distance Party.
We started out with 10 people, and it felt really good, and it was good to see each other and get a chance to laugh and move our bodies and sweat a little bit.
Ani Taj conceived of the Social Distance Party last month with some friends and colleagues from the Dance Cartel, a performance group she directs in New York City. Normally, the troupe tours internationally and combines live DJ sets and audience participation as part of its shows.
It was starting to dawn on us, watching what's been happening in other countries, that, oh, we might be inside for a while. And there was a kind of gloomy feeling in the air. And I had this moment where I was like, oh, we're not going to be able to dance for a while. Like the thing that I treat as very ordinary and part of healing and laughing and socializing and like really key to my thriving is not going to be available. And when that dawned on me, I just like, I put on social media, you know, does anybody want to do a dance party on Zoom?
The process for partygoers is simple. Log into the Zoom meeting where the party is held, set up your camera shot using your computer or phone. Finally, log on to another website called Mixlr. A DJ set there created especially for the event is broadcast live. And then get to dancing. The event is free, but participants can choose to donate to the hosts and DJs, or they can give money to the various causes the organizers call attention to at each party. The events are advertised on Instagram, and people have joined from around the globe.
I was just filled with such joy when a new friend would pop onto the screen. It was literally like they walked into the room that I was in and be like, oh, you're here too. It's, you know, it's like when you're at a big house party and another friend walks through the door. It had that same feeling.
You can be on your own dancing, and then you look to somebody, connect with the moves. I miss this going to the nightclub and meeting somebody extremely new. And the social distance is like my going to my nightclub and staying in my house. I think that's the most precious thing.
For me, when I'm moving and when I'm dancing, I'm actually able to process my feelings and thoughts about this moment in history a lot better than when I'm sitting still. So to be able to share that in community feels vital.
Ani Taj says, with every week, the social distance party is proving to fill a gap for folks who need connection and relief during this difficult time.
It's freeing, I think, for people to express themselves in a physical way where they don't have to explain what they're thinking and feeling, and you can kind of like get the fears out physiologically, because we all have a lot of anxiety and kind of pent up feeling right now. And I know for me that dance is really good for channeling that. So I hope it can be for other people too.
As everyone knows, America's children are going to school online these days, and how that will affect education is yet to be known. But as NewsHour Weekend special correspondent Carla Murthy reports, classroom social distancing does not have to mean the end of social traditions.
This is what second grade class used to look like at this elementary school in New York City. Now it looks like this.
Good morning, Jason. Good morning, Sevens.
But even now, these second graders have kept up the tradition of sharing their highs and lows at the end of the week and what they're looking forward to. A rose, a thorn, and a bud.
Are you ready to share? Would you like to share?
Yes, but I only have a rose.
That's okay.
Watching Lego Masters with my dad.
My rose is going to this awesome sea glass beach on Wednesday. There were like this big sizes of sea glass.
Me and my dad were building garden beds and shoveling dirt, and I thought that was really fun.
Being able to be with my guinea pigs while doing handwriting.
My rose was Lilu's birthday. My thorn is not being able to see you guys. And yeah.
I'm writing a book about animals, and I had some trouble thinking of stuff about leopard frogs. My thorn is going to see my grandparents because they have coronavirus, so it's really hard to see them like through a window and not like be able to be there with them.
My bud is making banana bread tonight.
It's Friday, so I have movie night, and me and my sister are gonna watch Star Wars.
My bud is looking for, and I have two buds, Easter, and I'm also looking forward to seeing you guys again.
Yeah, same.
As this weekend and the holidays celebrated by millions draw to a close, we want to take a moment to again honor the people on the front lines of this battle against the coronavirus. Our thanks to the doctors, nurses, emergency medical teams, and scientists, and to the workers driving buses and trains and others in grocery stores, warehouses, and in shops and stores large and small who are also caring for us in so many ways. That's all for this edition of PBS NewsHour Weekend. For the latest news updates, visit pbs.org/newshour. I'm Hari Srinivasan. Thanks for watching. Stay healthy and have a good night.
PBS NewsHour Weekend is made possible by Bernard and Irene Schwartz, Sue and Edgar Wackenheim III, the Cheryl and Philip Milstein family, Rosalind P. Walter, Barbara Hope Zuckerberg, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments. Additional support has been provided by the Corporation for Public Broadcasting, a private corporation funded by the American people, and by contributions to your PBS station from viewers like you. Thank you.
You're watching PBS.